Hi, I'm Chris Gagliardi, National Patient Pathways Manager for St John, and in this short presentation we'll be discussing the 111 Clinical Hub rollout in the Bay of Plenty area. So the Clinical Hub is a partnership initiative with Home Care Medical. It was originally piloted in mid-2014 in the 3 Metro Auckland DHBs. Soon after it was expanded to the Northland, Waikato and Greater Wellington DHBs, and at the start of 2017 the Ministry of Health approved funding for a full national rollout. So the objectives of the Clinical Hub are very much to provide the right care at the right time to low acuity 111 callers through clinical telephone assessments or secondary triage and onward referrals to community-based health services. Secondly, the aim is to reduce the volume of ambulance presentations at EDs where it's safe and appropriate. And thirdly, to improve ambulance service capacity to respond to time-critical calls in the community, such as STEMI, stroke and major trauma, by better managing our low acuity 111 caller demand. So how does the Clinical Hub work? Well, it all starts with a 111 call to one of our 3 ambulance control centres in New Zealand, so either in Auckland, Wellington or Christchurch. The call is then triaged by a call handler using a system called ProQA and allocated one of 5 response colours. So purple and red is immediately or potentially life-threatening, orange is urgent or potentially serious, and green and grey is low acuity, so neither serious, life-threatening or urgent. And it's these green and grey calls that we're the most interested in when it comes to the Clinical Hub. So if the patient's issue meets a specific type of green and grey determinant, then the call is sent through to the Clinical Hub and either a registered nurse or a paramedic phones the patient back and uses a decision support tool such as Odyssey or Manchester Triage to perform a more in-depth telephone assessment or a more in-depth triage of the patient to determine best care for them. And that may well be to send an ambulance or an ambulance resource such as a car, or it might be to provide self-care advice, refer the patient to their GP, or advise the patient to visit an accident and medical clinic or another health provider. So the Clinical Hub is currently in place in these areas, so in the Auckland, Northland, Waikato and Greater Wellington areas. In quarters 1 and 2, the Clinical Hub is being rolled out in Nelson Marlborough, Bay of Plenty and Hawke's Bay, followed by Lakes and Tairāwhiti. And in quarters 3 and 4, the Clinical Hub is being rolled out in the remaining DHB areas. And so by the end of 2017, the Clinical Hub will be operational across the whole of New Zealand. So what is the impact of the 111 Clinical Hub in the Bay of Plenty DHB area? Well, we predict that approximately 25,000 111 calls will be made per annum. And of that number, we anticipate approximately 13.9% or 3496 will go through the Clinical Hub. So of the 25,000 111 calls, 13.9% of those, which works out to be approximately 3,496, will go through the Clinical Hub. And of this number, we anticipate that an ambulance or ambulance resource will be dispatched to 73% of those incidents. So an ambulance is still sent to the vast majority of patients. However, there's a core group of 27% of the 3496 where we believe there will be a smarter and more effective way to meet the patient's needs and enable them to be treated closer to home. So approximately 297 patients per year will receive self-care advice or care plans, and approximately 647 patients, or 1.8 patients more a day, will be referred from the Clinical Hub to a GP practice or after-hours clinic. So in summary, approximately 13.9% of all calls will go through the Clinical Hub, which is approximately 3,496. Of that number, the vast majority will still be sent in ambulance. However, there's a core group of 27% where the patient will be treated with self-care plans or advice or referred onto a GP or accident and medical clinic. And so the key message here is that We're trying to connect patients with their health home where it's safe and appropriate, and we don't expect GPs to be inundated, and that 1.8 patients more a day is across the entire district, so across the entire Bay of Plenty DHB area. Thanks very much for listening, and if you've got any questions or would like any further information, don't hesitate to email me at chrisga@stjohn.org.nz. Thank you.